Hello everyone and welcome to my channel, and in my today's video I am sharing the front shoulder treatment series. So in my first video I am sharing the acromioclavicular movement with mobilization technique for the patients who have difficulty in achieving full range of flexion movements and horizontal adduction movement. So the indication for this mobilization technique is hampered shoulder flexion and hampered the shoulder adduction, horizontal adduction movement. So for the treatment purpose, the patient is in the sitting position, and let's say the patient have difficulty in achieving the shoulder flexion in the left hand is painful or the dysfunctional side. So first the therapist has to place his ulnar border on the lateral part of the clavicle. So this is the lateral part of the clavicle, this is the lateral part. So the therapist has to place his lateral border on the ulnar border on the lateral part of the clavicle, and from the another hand the therapist has to overpressure the caudal glide, and while maintaining this glide the patient is asked to perform the shoulder flexion movement. So what is the treatment? The therapist has to place his ulnar border on the lateral border of the clavicle. This is the clavicle. Now the therapist has to reinforce his glide, the caudal glide. From the another hand, now the patient is asked to perform shoulder flexion. Perform the flexion. While maintaining the glide, the patient is asked to perform the shoulder flexion movement. Perform full range of motion and relax. Again relax. इसमें आपको एक बात ध्यान क्या रखनी है, अगर पेशेंट खुद से फुल रेंज अचीव नहीं कर पा रहा है तो आप पैसिवली भी रेंज अचीव कर सकते हैं ग्लाइड को मेंटेन करते हुए. तो करना क्या है, आपको अल्नर पार्ट कहाँ रखना है, लेटरल पार्ट ऑफ द क्लेविकल इस जगह. फिर आपको एक डाउनवर्ड ग्लाइड देनी है, कॉर्डर ग्लाइड इस तरह. उसके बाद पेशेंट को बोलना है शोल्डर फ्लेक्शन करने के लिए इस तरह. दिस इज़ द फर्स्ट मोबिलाइजेशन. सेकेंड, आपको अपना ग्लाइड का एंगल चेंज करना है इस तरह. उसके बाद पेशेंट को बोलना है हॉरिजॉन्टल abduction करने के लिए. So you have to give a caudal glide in a diagonal method. So this is the glide. Again perform the horizontal abduction. Yes, you have to perform the horizontal abduction movement. Back, again and back. So perform this mobilization technique 3 to 4 times in a single set and perform 3 to 4 sets in a single session. You will get significant relief in achieving the hampered ranges and also in decreasing the pain. So perform this acromioclavicular inferior movement with mobilization technique to increase the flexion ranges and horizontal adduction ranges, and let us know your valuable feedback in our comment section. Till then, stay connected and thank you.